It's time for another webinar from Alleviate's pain webinar series. So my name is Dr. Khaja Javeed Khan. I'm a pain management specialist at Alleviate Pain Management Clinics. And today's topic is called as arthritis from a pain specialist's point of view. All right. So without further ado, I'll just be starting off my presentation. So the overview of my presentation is going to be under the following headings, starting off with a small introduction, looking into what is arthritis, its symptoms and signs, the investigations or tests what a doctor would prescribe when a patient suffering with arthritis comes to him. And next would be, how does a pain specialist manage arthritis, which is the main crux of my presentation today. And finally, the conclusion. So, introduction. Well, a common complaint which we see in patients coming to us in the pain management OPD is patients complaining of pain and swelling in the joints region. This is quite a sight. Usually we get a lot of patients and commonly they have these kind of symptoms when they come in and talk to us. So other things are the patients tell that the pains are usually chronic, have been there for a long time, and they have been suffering from these problems. The pain and the difficulty in mobility has been affecting their daily activities. Right. So with all these questions in their mind, the one question which comes to our mind is this arthritis? Well, let's move ahead to know more. What is arthritis? Right. So arthritis is usually a swelling and tenderness of one or more of your joints. Right. There are a lot of joints in the body, and many a time, whenever people end up developing pain or swelling over the joints, the pointers point towards a diagnosis of arthritis. So commonly, there are two types of arthritis. One is osteoarthritis and the other is rheumatoid arthritis, which are fairly known in today's population. So moving ahead, let's look at what would be the symptoms and the signs of arthritis. So the first and most common complaint is called as pain and only pain. Pain in the particular joint, wherever the patient is presenting to you with. It could be anything. It could be anything like the knee, the hip region, the shoulder region, well, even in the back, the spine as well, there can be certain amount of pain due to arthritis. Next symptom is something called as stiffness. Well, many patients with back pain, they come to me and they tell that whenever we wake up in the morning, we have a certain thing like, the back feels stiff. So this is a kind of a pointer towards arthritis, which we call it in our medical terminology as morning stiffness. Morning stiffness is usually quite an indicator and a significant sign of a certain kind of arthritis called as ankylosing spondylitis. Other symptom is swelling. In cases of rheumatoid arthritis, usually, we find that the joints are red, inflamed, and swollen, and patients are in severe pain. So swelling is a cardinal symptom of arthritis. Even in other arthritis, like osteoarthritis as well, there can be little amount of swelling over there due to accumulation of inflammatory effusion of fluid. Redness is a cardinal feature of the inflammation. As we all know, inflammation has rubor, calor, dolor, punctulasa, etc. So redness is a rubor, which is a feature of inflammation within the joints. Decreased range of motion. Again, patients come and complain with not only pain, but difficulty in moving that particular limb or that particular joint, which is involved in case of arthritis. Right. So let's look at a few common types of arthritis. Osteoarthritis. Osteoarthritis is the most common form of arthritis. The incidence, it's told in our country, is almost close to 45 to 50%. That means 1 in 2 individuals suffer from osteoarthritis. What happens in osteoarthritis generally? Osteoarthritis causes the cartilage. Now, what do I mean by the cartilage? Well, if you look at any joint, two bones form a joint, right? And in between the two bones, there is a certain structure which is called as a cartilage. The cartilage acts like a shock absorber. If I have to explain with the help of an example, let me take a model. Right. So this over here is a model of the knee joint. All right. And this is the upper bone, which is called the femur, right? And the lower bone, which is called the tibia. In simple terms, this is the thigh bone and this is the leg bone. And this is a kneecap, which is present in front. So if I just move this aside, this is what you're looking at as the joint region. Okay. Now, over here, if you see, this part of the joint has a certain coating called as a cartilage. Now, this cartilage acts as a shock absorber. Okay, it's a kind of a hard, slippery tissue which covers the end of bones. There's a cartilage over here, there's a cartilage over here as well. Now, these bones form a joint, okay, and the cartilage is present in between these bones. So, this cartilage, what it does is it acts as a shock absorber. Whenever someone is walking, okay, the motion is happening something like here, like this, right? So the cartilage helps in ease of the motion. Well, what happens in osteoarthritis? This cartilage is going to develop a wear and tear. There's going to be a break in the continuity of the cartilage, which is going to result in a certain inflammation and resulting in pain. Well, the wear and tear doesn't just occur overnight. It is a long process. It's a chronic disease. So this is a part of a chronic pain syndrome. And this wear and tear occurs over many, many years. But there are certain factors which can hasten the wear and tear as well. What could they be? Firstly, it could be any injury, a direct injury to the joint, which can, increase the wear and tear. And infection, if the joint has got infected, also osteoarthritis can, set in early and progress early. Moving ahead. So something called as rheumatoid arthritis, RA is a short form. So a lot of the general population would have heard of this term called rheumatoid arthritis. Yes, it does put a stigma in the mind, but we need to understand what happens in this particular disease, right? So rheumatoid arthritis is a kind of an immune disease, okay? The immune system, it starts attacking the joints. For example, the body starts turning against itself. The immune system sends certain cells. It's a problem of the immune system wherein, the lining, that is the cartilage, the synovium, all of this start getting affected because of rheumatoid arthritis. So this synovial membrane becomes inflamed and swollen. This is referred to as a destructive disease, which has a destructive process. So this process can eventually destroy the cartilage and the bone within the joint as well. Rheumatoid arthritis is usually seen in the younger population as opposed to the osteoarthritis, which is seen in the older population. So rheumatoid arthritis is more destructive and more fatal. And commonly it is seen in the small joints of the body. For example, the fingers, right? The fingers are the joints which usually get involved. They become swollen, bulbous, red, inflamed, and tender. So other form of arthritis are also there. There's something called as crystalline arthritis, wherein you would have heard of something called as gout, right? Wherein the uric acid levels in the blood are high. So these uric acid crystals go and get deposited within the joints. Usually the big toe is the most common site, which is referred to as podagra in our medical terminology. And other form of arthritis like in association with certain diseases like psoriatic arthritis, etc. These are also quite common. Okay, so moving ahead, let's look at few of the common joints which are involved in case of arthritis. So the common joints involved in case of arthritis include, firstly, the knee joint. Remember, the maximum catastrophe which arthritis produces is usually in the knee joint, right? So knee joint is a very important joint of our body. Knee joint is kind of takes the entire weight of an individual. takes the entire stress whenever anyone is, standing or walking or climbing stairs. So this is a picture of comparison between a healthy joint and a rheumatoid arthritic knee joint. So looking over here, this is the bone again over here. We have the cartilage over here, as I had explained on the model. Down we have the meniscus and other ligaments around. So if you compare this with rheumatoid arthritis, there's going to be inflammation of the synovial membrane, this red thing, what you are seeing over here. Okay. So what you're seeing over here, this is the thing, what is the bone, and then the swollen inflamed synovial membrane. Okay. And we have the cartilage over here as well, which is kind of wearing off. The joint space gets reduced, which is a very pathognomic feature of arthritis. Okay, so this is in comparison with rheumatoid arthritis, wherein the knee becomes red, inflamed, and swollen. All right. So let's have a look at osteoarthritis. So osteoarthritis is a general wear and tear which is there over the years. As we see over here, we have the bone and we have the cartilage over here, and the cartilage is developing certain cracks. Can you see the cartilage is beginning to break down over here? There is the meniscus is eroding. There is formation of bone spurs as well. So this is how this is a picture of osteoarthritis of the knee joint. Right. So any arthritis, there are going to be stages. Okay, starting with the early stages to the last stage. So over here we have the first stage, wherein there is beginning of joint destruction. Stage 2, the cartilage is starting to wear and tear even more. Grade 3, there is even more. There is reduction of the joint space as well. Bone spurs are forming. And grade 4 is the last stage, wherein there is bone on bone. Okay. So this is how a knee osteoarthritis develops over the years. Moving ahead, let's have a look at the hip joint. Again, a very important and a common joint involved in case of arthritis. So this is a healthy hip joint and this is an osteoarthritic hip joint. Okay. As you can see over here as well, there is the cartilage is breaking down. Okay. And the joint space is again getting reduced. So this is an X-ray of one of my patients who I had seen a couple of weeks back in the OPD. The patient came in severe difficulty in, walking or even standing, let alone sitting. So the patient had pain and difficulty in movements as well. So she came along with an X-ray of her hip joint. So here we are seeing this is a plain X-ray of the hip joint. Well, let me explain this X-ray a bit. Okay, this is the thigh bone going in. This is the pelvic region. Okay, this structure is one second, let me use the mouse. So over here, what we are seeing over here is this is the pelvic region. All right, this is the thigh bones over here. This is the hip joint region, what we are able to see. So as you are seeing over here, the hip joint, there is almost nothing left. There's degeneration, severe degeneration. Okay, and reduced joint space. And what you're seeing over here is one of the most severe stages in hip osteoarthritis. Moving ahead, the shoulder joint. Yes, the shoulder joint also can get involved in case of arthritis. And shoulder joint, one thing what we need to remember is it is commonly whenever someone has shoulder pain, it's not just the joint which is getting involved, which we need to evaluate. We have to look at the other structures as well. For example, we have to look at the rotator cuff muscles, the tendons. They can be tendinopathies, right? They can be tendinitis. Subacromial bursitis can also get involved. An adhesive capsulitis is again a very common thing, wherein the shoulder gets painful and the movements become restricted and very, very tender. Right. Shoulder joint arthritis, again, the joint can get involved in case of wear and tear, rheumatoid, as well as osteoarthritis can present. So this is again an X-ray of one of the patient who had come to the OPD, severe degeneration, severe arthritis again. As you're seeing, this is, let me explain a bit about the X-ray first. So, yeah, this is the arm, okay, the humerus, the arm bone. This is the shoulder blade over here. This is the collar bone, right? And this joint is the one which is called as a shoulder joint. What we need to understand over here is there is severe restriction of joint space, degeneration happening, and a lot of bone erosion as well. This is a patient, what you're looking at over here is a patient who presented with rheumatoid arthritis. He had rheumatoid arthritis over his fingers. There was a lot of deformity as well. And then the shoulder joint has undergone this much amount of destruction. So rheumatoid arthritis, remember, is always a destructive kind of a disease. All right, moving ahead to the spine. Yes, the back as well can develop arthritis. Ankylosing spondylitis is one such condition. There are a lot of joints within the spine. What you see is there are each block of bones arranged one over the other, forming a joint with the help of facet joints, sacroiliac joints as well. The ribs coming in and joining the costovertebral joint. There are n number of joints taking from the neck to your tailbone, the cervical, thoracic, the lumbar, the sacral region, all joints. So any of them can get involved in case of arthritis. Ankle region as well can also develop arthritis. Quite common in sports persons, people who had sustained earlier ankle injuries. All of these people can develop arthritis quickly. Other joints, yes, the elbows, and then the wrist, shoulders, the hand, the fingers, you name it, and most of the joints can get involved, especially smaller joints in case of rheumatoid arthritis. So as you are seeing over here, the fingers, yes, this is a person with rheumatoid arthritis. There is swelling over the joints and then a bit of deviation as well, as you are seeing. Moving ahead, these are a few of the joints which were involved. So whenever you visit a doctor's clinic, doctor's chamber, indications are something which are written to confirm the diagnosis of any kind of an arthritis. Blood tests are very, very commonly done procedures. And what we need to understand over here is usually blood tests are advised to a patient to rule out arthritis, because in the blood there are certain inflammatory markers which we want to look at. For example, there is something called as ESR, erythrocyte sedimentation rate. There's something called as CRP, C-reactive protein. Okay, so these are few of the inflammatory markers. Specific markers include, especially for rheumatoid arthritis, we have the RA factors, we have the anti-CR. So a blood test is a common thing which you may be advised. X-ray. Remember, X-rays are usually done when we want to have a look at how the bone is and how the joint is. Okay, so this is an X-ray of a normal knee joint and comparing it with an arthritic knee joint. As it is there over here, let me annotate this. This is a knee joint. This is the femur, the tibia, the normal knee joint. As you can see, it looks clean and there is a good cartilage over here. Normal joint space as well. Comparing it with this, you can see that the bone is irregular, has developed osteophytes, erosions, etc. The black line seen over here is gone almost. The cartilage is, worn out because of wear and tear. And this is a classical X-ray of an arthritic knee joint. Next is ultrasound. Ultrasound is usually used for the soft tissues. If there are any effusions, as I was telling to you, the joint can get inflamed and red. So it is usually seen in case of rheumatoid or osteoarthritis, wherein the ultrasound is going to help us have a look at whether there is any fluid accumulation inside a particular joint region. MRI. All right, a doctor may advise you an MRI, especially if there is any involvement, any prior injury, involvement of any ligaments, because we have to look at the continuity. Is there any tear or tendinosis or anything? So for that reason, MRI is usually employed. Right. So let's come to the main crux of today's topic regarding how does a pain specialist manage arthritis, the pain specialist, right? So pain specialist, see, I'm a pain management specialist. We have qualified individuals who have done a super specialization after completing our MBBS and MD. So what we do is we specialize in a certain branch of medicine called pain medicine. Pain medicine is a relatively new branch of medicine. To keep it, to explain to you in a more simpler way, if someone has a heart-related problem, a chest pain, they go to a cardiologist. If someone has sugar or diabetes, they go to a diabetologist or an endocrinologist. In the similar way, anyone having any kind of pains, head to toe, inclusive of joint pain or arthritis, visit a pain management specialist. So as a pain management specialist, how do we look at a certain thing in a different manner? How do we approach a certain situation in a certain different kind of an approach is what I will be highlighting now. So what we need to understand over here is we employ a multidisciplinary approach. In today's world, with people suffering most of the illnesses, what we need to keep in mind is most of them are lifestyle induced, right? So there are a lot of diseases or ailments which people are suffering from. And there is no one particular treatment which we can single out and tell that, this is going to work for, especially for a problem like arthritis. For arthritis, remember, there is no magic tablet. There's no magic cure. There's no one magic exercise or an intervention or a surgery which is going to solve the problem completely. First thing we need to understand is arthritis is a certain condition which does not have any cure. Yes, you're hearing it right. Arthritis doesn't have any cure. If your joint is involved with any arthritis, it is going to get degenerated, further and further and further. But arthritis is a certain condition which can be controlled. I can compare it with something like diabetes and hypertension. Diabetes and hypertension as well do not have a permanent cure, but they can be controlled. Hypertension can be controlled by medications to bring your blood pressures back to normal. Diabetes can be controlled by either the insulin or the tablets, etc., to bring your blood sugars back to normal so that they are in a controllable range and you are living with it in a normal fashion. Same with arthritis. Arthritis also as a condition can be controlled. So we have to concentrate on how to control this arthritis. And for that reason, a multidisciplinary approach is what is the most validated and most effective approach for dealing with arthritis. So what does this multidisciplinary approach include? Well, over here, we look at the problem as a whole. We use medications. We use physiotherapy exercises as well. We use interventions which I will be explaining in more detail. And then for patients who are not going to benefit from any of these and who require a surgery, yes, surgery as well is a part of the multidisciplinary approach. So with this in mind, let's move ahead. Right. So coming to a multidisciplinary approach of arthritis, what we need to understand over here is we need to tick all the boxes, right? So we need to approach the problem one by one. The first important thing is weight. Remember, whenever there is an excess weight, the joints are the ones which bear the brunt, starting from your neck to your, ankles or to your feet. Every joint is affected with weight. If I take the example of the knee joint, remember our knees are designed to take the weight of the body, but then there's a certain limit, right? If your weight is as per normal BMI conditions, your knees are healthy enough to sustain that much amount of weight. Every 1 kg increase in weight, right, adds 4 to 6 times that much amount of pressure over your knee joints. Yes, you're hearing it right. Even a 1 kg of weight is going to increase the pressure over your knees by 4 to 6 times, right? And similarly with the other joints as well. So if I conversely say this, even 1 kg of weight loss is going to decrease the pressure over your already loaded knee by 4 to 6 times. So what it does is, it decreases the pressure over the joints. The joints are under less stress, and of course, less degeneration of the joint and less pain as well. So weight loss as a strategy is very effective. And I advise to all of my patients coming in with arthritis to, especially those who are overweight, concentrate on weight loss. Next approach is diet. Remember, diet is what is most important for weight loss. Always, whenever you consult a nutritionist or someone who is certified in helping you out with this weight loss program, they tell a very common thing of the diet, and 10 to 15% from exercise, and the rest is made up by sleep. So you can understand seeking weight loss. Remember, whatever you eat is very important. So this is contrary to the statement that you need to starve to lose weight. I would say the opposite. You need to eat healthy to lose weight. So diet is very, very important. So always remember to have a diet which is rich in proteins, less in calories and fat. So caloric deficit diet is what should be your goal if you are intending to do any kind of a weight loss, not just for arthritic patients, for any kind of patients. Decrease in calories is what is most important if you're looking at weight loss. Now, there are certain foods which fight inflammation, which are good for people suffering from arthritis. They include the fish, healthy fats like nuts, avocados, etc. Fruits like prunes, raisins, berries are quite good. Legumes are good, and supplements like omega-3 fatty acids. Vegetables like spinach, Brussels sprouts are good. Yogurt is also good. Turmeric, whole grains, etc. So all of these are foods that fight inflammation, and they have a role in dealing with arthritis. Calcium is again a very important thing because it's the building blocks of your bones. So remember to include calcium-rich foods in your diet. Almonds, soya, beans, dairy products, fish, meat, orange, broccolis, all of these are foods which are rich in calcium. Next is vitamin D. So vitamin D rich foods is what we need to take. Almost 90% of our population is deficient in the vitamin D. Now with all the COVID, the lockdowns and the work from home culture which has been happening, the vitamin D levels have even more fallen, and the population is at large exposed to deficiency of vitamin D. So a lot of foods are there which are rich in vitamin D, but I would say sunlight is one of the best source. So make it a point to give your body the necessary exposure to sunlight every morning. So the body itself makes its vitamin D when it is exposed to the sun. Other foods rich in vitamin D include egg, the yolk, the cod liver oil, fish, mushrooms, cereals, etc. Next is exercise. Exercise is what is very, very important. Walking is the best form of exercise, right? A 30 minutes walk a 20 to 30 minutes walk a day should hold you in good stead. Remember, consistency is what is the most important thing. So about a half an hour walk for 4 to 5 times a week should keep your body in a good condition. And one common myth which is there in everyone's mind is, especially the one suffering from arthritis. The patient asked me that, when if we walk, is the pain going to increase? If we are going to exert ourselves, some kind of an activity, are we going to aggravate our arthritis? I would say no. On the contrary, it is going to help strengthen your muscles, which would definitely help you in your arthritis. Of course, certain form of exercises which place extra pressure over someone suffering from knee osteoarthritis would need to be avoided. For such patients, I advise things like, swimming, cycling a stationary bike. All of these kind of things are going to help you in your physical activity. So moving ahead, strengthening exercises, I always advise my patients strengthening exercises. Here you can see someone doing strengthening exercises for their knee joint. Okay, this is similar to this. There are specific exercises for the different joints, and we have to concentrate in strengthening the muscles and building the muscle bulk and tone, so that our body is more prepared to fight with this arthritis. Medications are there. They have been there. They have been being prescribed for the sake of arthritis, and especially for rheumatoid arthritis, there are certain medications which are prescribed, something called as DMARDs, the disease modifying anti-rheumatic drugs. There are the biologicals as well. So because rheumatoid arthritis itself, as I said, it's a disease process of the immune system. So they are there to, bring your immune system back to the stage where, it is no longer trying to destroy its own cartilage. Other kind of diseases like, the uric acid, urate arthritis, psoriatic arthritis, etc. They have specific medications. Osteoarthritis as well, we do use a lot of medications, like someone suffering from severe pain can just pop in an analgesic or a painkiller so that the pain gets decreased for a certain period of time. And calcium and vitamin D supplements nowadays are becoming like part of the medication list for anyone suffering from arthritis. So medications also assume a role, but remember to not take a lot of medications. I don't prefer writing a lot of painkillers for my patients, because it ends up developing a certain kind of a dependent behavior among the patients. Moving ahead, yes, surgery for patients who are in the later stages, the last stage of arthritis, surgery is what is advised, and which needs to be done, be it a knee replacement surgery like what is seen in the picture over here, or a hip replacement surgery, shoulder replacement surgeries also, etc. So depending on what stage of arthritis it is, we have to manage. Right. So what do we do as a pain management specialist? How do we approach arthritis in a certain different manner? Till now, whatever you saw is all the treatments which have been happening from the time memorial. I mean, from the beginning, what are all treatments? Arthritis has been managed by, either medications or exercises or finally surgery. Right. So what is new now? What are the latest advances in dealing with arthritis? So what do we as pain specialists do extra or different compared to others? Right. So what do? We first get to the root cause. What is happening? Where is it happening? When? Why? So why is the arthritis happening? And what is the reason for the arthritis? Is it osteoarthritis? Is it rheumatoid arthritis? What kind of arthritis? Is it first of all arthritis or not? So we have to find the root cause, because until we don't find the root cause, the treatment, we cannot do the right form of treatment for that particular patient. Right. So moving ahead. So once you have found out the root cause, if usually the patient is in early to middle stages of arthritis, we use something called as regenerative medicine. Yes. Regenerative medicine now has had been under study for a very long time. But now in the recent literature, what we can see is a lot of patients with arthritis benefiting potentially with regenerative medicine. So what does regenerative medicine do? It follows a simple principle of allowing the body to heal itself. The body heals by itself. So we are using the body's own products to heal itself. One of the very common treatment is something called as platelet-rich plasma. PRP. Few of you would have heard of the term of PRP. Commonly, you would have heard of PRPs being used for baldness or hair loss. Well, PRPs do have an application in arthritis as well. So let's know more about PRPs. Well, what you need to know is our blood contains of three components: the red blood cells, the white blood cells, and the platelets. So the red blood cells give the inherent red color to the blood, right? The WBCs give us immunity, and the platelets are the one which do the repair work, right? So anyone who's got an injury or something, if the wound has to heal, the platelets are the one which are a storehouse of growth factors, and they bring about a natural healing process. So what is a PRP? PRP contains 94% of platelets and plasma and 5% of RBCs. So what you're seeing over here is the platelets, which were normally 6% in a regular blood sample, are taken, separated, centrifuged, concentrated, and that is when a PRP is formed. So what we do with this PRP is we take it and we inject it inside the joint which is developed arthritis. For example, if it is the knee joint, what we do is we take the PRP and we inject it inside the knee joint. So how is the PRP going to help? What you need to understand over here is, in case of arthritis, there is a cartilage wear and tear. The cartilage is, kind of breaking down. So what this PRP does, it goes in, it seals the gap, it starts bringing about a natural healing of the cartilage. So the cartilage which is worn and torn will kind of start healing with this PRP. So what are we doing over here? We are injecting the PRP so that, the joint is developing an inherent healthy environment, right? So as per the recent literature, PRPs are showing excellent results in early to middle stage of arthritis and comparative results in the later stages. So anyone suffering from arthritis, yes, PRP is an effective treatment modality which can be employed. And the PRP as such, the biggest advantage of it is devoid of any side effects. Yes, so because the PRP is taken from the patient's own blood, synthesized, processed, and injected back into the area where there is arthritis. PRPs are totally safe treatments, and it promotes natural healing. So this is a sample of blood which has got centrifuged, and what you're seeing over here lower down is the red blood cells which have settled down, and then we have the platelet poor plasma which has gone up, and in middle layer, let me just annotate this. These are the red blood cells. This is a platelet poor plasma, and this is a platelet rich plasma, the middle layer. This is the layer which is taken and it is injected inside the joints. Right. Moving ahead, we have something called as VISCO or gel injections as well. Any joint in our body has a certain inherent fluid or a liquid, the synovial fluid, which kind of lubricates the joint. With increasing arthritis, the joint lubrication also comes down, which makes it dry, hard, and painful. So with the help of this VISCO or gel injections, what we are doing is we are getting the joint, its lubrication back. So the joint is getting lubricated back, and then, it helps in the movements and then reduction in pains as well. As per the recent literature, the combination of PRP and gel injections have shown better results compared to individual interventions. Next up is over here, me doing a PRP injection using an ultrasound in one of the patients. This was a patient who had come in the early stages of osteoarthritis and who had undergone the treatment and had excellent relief with the PRP treatment. So this is again the same procedure, but using the ultrasound, not the ultrasound, but the X-ray machine, X-ray guidance. So use an X-ray machine to do our procedures, but everything is done under image guidance. So this is an X-ray image of PRP being injected inside the knee joint. This is a knee joint over here, all right, and the needle going in all the way inside the joint, and this is the dye, what you're seeing, to confirm the spread inside the knee joint. So everything is image guided, and all of these procedures are done in a sophisticated manner, which makes them totally safe and convenient to give the best experience to the patients and be devoid of side effects as much as possible and complications as much less as possible. Moving ahead, this is the hip joint, an injection which I had done inside the hip joint region for a patient in the early stages of arthritis. So an injection of PRP and the gel, both. So this is me doing using a hybrid technique, using both the X-ray machine and then the ultrasound machine as well to target the hip joint region. Shoulder, again, can get involved in case of arthritis. So what we do is we use an ultrasound machine. I use the ultrasound for all of my shoulder patients and then use it for my intervention so that, you know, the regeneration process happens as effectively as possible. Next up is the spine. Ankle injections are also common. So in the spine as well, as I was saying, there can be development of arthritis. So what we do is we do a lot of something called as prolotherapy as well. Prolotherapy is a kind of a therapy which is done over sessions and wherein the muscles and ligaments which are there are tightened and strengthened around the back. So a lot of recent literature has come supporting the prolotherapy of the spine and even for the PRP, for the various joints like sacroiliac or facet joints, etc. So what about patients who come in the late stage of arthritis? Is surgery the only option? Well, it is the best option for patients who are presenting in the later stages of the last stage of arthritis, especially those suffering from knee arthritis. Okay, but there is a certain part of the population who wants to have some other kind of an option other than surgery. So I get a lot of patients who are coming to me, and many of them are in a late stage of arthritis. So what do? Do we send them back saying that, you know, surgery is the only option, or has medical science advanced to a stage where we have an answer to such patients as well? I would say yes, there is hope. There is still hope for such patients. A new kind of a treatment called radiofrequency ablation is becoming popular. So what is radiofrequency ablation? What we do over here is we target the painful nerves around that particular joint. So anyone suffering from arthritis, especially osteoarthritis in the later or last stages, they suffer from a lot of pain because of bone on bone grinding going on, right? So what we do is we target the nerves around these painful joints and we selectively ablate or block those nerves. Yes. How does it help? So the pain, once the painful nerves are blocked, the pain signals are stopped and they do not reach the central processing system of our body. So that which renders effective pain relief around that particular joint in question. Right. So this is an example of knee radiofrequency ablation, wherein the painful nerves are being targeted. Okay. This is me doing a radiofrequency ablation of the knee joint of one of my patient using ultrasound guidance. So let me just annotate this a bit. Yeah. So what we are seeing over here is this is a machine, which is a cool radiofrequency machine. Okay. And this is the transducers, right? The needles. This is the ultrasound probe, what I'm using over here. This is an ultrasound machine. So this is a ultrasound guided technique, what I'm using for the radiofrequency ablation of the genicular nerves of the knee joint. Right. So again, this is another patient who's undergoing radiofrequency ablation of the knee. So here's a few certain video which I have taken when we were doing an ultrasound guided radiofrequency ablation of the knee. This is a video of how the genicular artery looks. So for my medical colleagues out there, remember that the nerves always follow the arteries. So we are locating the genicular arteries to get to the genicular nerves. Genicular nerves are the nerves which supply the knee joint, right? The knee genicular nerve. So let's have a look at this video. So what you see over here is and the Doppler, and this is how a artery looks like. Okay, and this is going to be a target because the nerve is close to the artery, and we are going to target this structure, which is the artery, because the nerve is quite close to it, and we are going to do an ablation of that particular nerve. Next up is this video. Let me play this. So what over here we are seeing is this is the needle going down all the way. This pulsatile structure over here is the artery. So my needle is close to the artery over here, and radiofrequency ablation is going to be started. So why I'm showing you all these videos over here is to explain to you the sophistication of the procedures or the interventions what we do, wherein we are visualizing things we are doing. Nowadays, this is not the age or not the era of doing any blind injections. Everything is done under image guidance. And what you're seeing over here is needle, the nerve being closed, and then the radiofrequency ablation is going to be started. So everything is happening under image guidance. Moving ahead, this is a hip joint, what we are seeing over here. And 1 second. Yes, I think we are back. So this is the hip joint, what we are seeing over here, and hip joint intervention being performed. Again, I always prefer using a hybrid technique wherein ultrasound and well as X-ray machine is used. So this is the radiofrequency ablation of the hip joint. This is an X-ray image, the fluoroscopy image of the hip joint. We have the femur, head of the femur here, the thigh bone. We have the pelvis over here. This is the hip joint, and this is my needle going in, targeting the painful nerves of the hip joint. This is targeting the obturator branches, the genicular nerves, wherein the cool radiofrequency ablation of the hip joint is being performed. Moving ahead, for the spine as well, we do the radiofrequency ablations. This over here specifically is a radiofrequency ablation of the sacroiliac joint. This is a sacroiliac joint, okay, and this is a needle, which is this is the RF needle, which is there close to the along the S1 foramen. So what we are doing over here basically is we are targeting the painful nerves around a particular joint, and we are going to ablate it selectively so that the patient has good and long-term pain relief. Moving ahead, what are the advantages of these procedures? So as I said, as a pain management specialist, I look at arthritis in a different manner. I don't believe in just giving the patient options of just medications or exercises, whereas we look at it through finding out the root cause and then giving the patient the right form of a treatment, depending on what stage of arthritis they're coming. So the interventions is one very useful thing, a kind of a tool what we use for patients suffering from arthritis. So a lot of patients have doubts about these interventions regarding what they are and what we do, because this is certain thing which is relatively new and which needs to be explained. So let me explain you a bit of an advantages of what we do as the interventions. What are the advantages basically of these interventions? So everything is daycare. Daycare in the sense, no need of any hospitalization. The patients come in, get the procedures done, and then they go back on the same day. Few procedures last even half an hour or 1 to 1.5 hours, depending on what procedure is being done. Next is patients can get back to work as early as the next day itself, or even the same day. Right? There's nothing like a prolonged bed rest, which will be advised to the patients. So they can get back to their daily activities as quickly as possible. No surgery. Well, few patients have the stigma of, surgery, or they're afraid to go under the knife. So for such patients, these kind of treatments are more acceptable. And as patients are happy to, get these kind of treatments done. Everything is done under vision, under image guidance, as you were seeing me using the X-ray machine, the ultrasound machine as well, so that we target the right point, and we are making sure that there are as much less complications as possible. Everything is done under local anesthesia. The patient is wide awake and they see the interventions which are being done. So the anesthesia related complications as well are nil over here. Only thing is local anesthesia, wherein a small prick would be there. A simple prick for the patient, that's it. And then there's going to be the anesthesia which is setting in, and it would be as much less painful as possible. But even though if it's a simple prick for the patient, it is equally and technically challenging for the pain specialist. With that, I would like to conclude my presentation telling that arthritis is a very common thing. Arthritis is so common in our country that 1 in 2 individuals suffer from it. The notion that I have to bear with pain is a totally wrong notion and a totally wrong thinking. Patient awareness is key, wherein we need to be aware of the all the options which are there to treat the arthritis. So remember, whenever anyone is suffering from arthritis, arthritis, as I had said before, it's a condition which needs to be controlled. So with that, I'd like to conclude my presentation. Thank you very much for your patient hearing.